Okay, welcome everyone to this evening's live webinar hosted by OrthoCincy and the Christ Hospital Network. I am Dr. Yuhas and I will be your presenter tonight. We are going to be talking a little bit about hand injuries today, and specifically hand injuries in athletes of all ages. Our title is Stay in the Game, Recognizing and Addressing Hand Injuries in Athletes. I'd like to thank Dan Wiggins as well as Matt Wood for help with this presentation. And thank you all for coming as well and being a part of this. Again, we're hosted by the Christ Hospital Health Network and OrthoCincy. OrthoCincy physicians such as myself, we operate at the Christ Hospital Joint and Spine Center, as well as some of their outpatient centers such as Red Bank and in Liberty Township as well. And we really appreciate and are grateful for their help with taking care of patients. Just a reminder, everybody's muted today, but you are welcome to participate by asking any questions in the chat box, and we welcome those. We'll answer those. We'll make sure we have time at the end to answer those questions. And also, this is a recorded webinar, so you will receive a link to be able to view and share as you like as well. Basically today, there are no financial disclosure, no conflicts of interest from myself. This is an educational webinar. We're going to talk about a few things as far as hand injuries in athletes, and that's, again, of all ages. We're going to highlight some cases. We're going to talk about some anatomy, some treatment options, and really just how athletes are treated and some different considerations that we have to think about as surgeons and as a team of healthcare professionals when we're dealing with an athlete and injuries and all of the questions that come along with it. So we're not going to cover everything, that's for sure, but we will try to kind of zoom around the hand and the wrist. We're really not going to cover too many elbow injuries. It is something that I see quite a few patients with elbow injuries and problems as well, but we will be both focusing mainly on the hand and wrist today. Again, my name is Dr. Mark Yuhas. I am a board-certified orthopedic hand surgeon with a subspecialty qualification in hand and upper extremity surgery. I graduated from UK College of Medicine and then did a subsequent orthopedic surgery residency there until 2015. And then I did a fellowship staying in Kentucky at the Louisville Kleiner and Coots Fellowship. These are my children, my three children off to the side, and I have a wife and three beautiful children. So again, that is a little bit about myself. So hand and wrist injuries are very common. We see them between a broad range, 3 and 25% of all sports injuries. So it's a lot. It's a big part of sports when we're dealing with on the field, and the next day we see these a lot in the emergency department. And when we think about treating an athlete, there are some unique considerations, and we'll go over those. But we really want to use the principles of evidence-based medicine, what we know works and what we know is effective, practical thinking. And we'll kind of go over that about the athlete, and then really effectively communicating those principles to the patient and to the athlete. It really comes down to a team approach, and it's really important when taking care of any patient to have a team approach. But in an athlete, we have other people involved. There's a team physician sometimes. There's a primary care physician for more of the maybe athletes who are more weekend warriors. There's an athletic trainer that's often involved. Parents for young athletes. Hand therapy, so important. And we have great hand therapists at OrthoCincy as well as within the Christ Hospital Network. So really a shout out to them as well, how great they do and how important they are to what we do. It's really important when you're talking with an athlete to really define your goals, their goals, and expectations right off the bat. And reinforce those things as needed, really kind of revisiting all these things as we're talking. Communication is key, and that's really with any patient-physician relationship, especially in these athletes, whether you're recreational, an elite young athlete, high school, college, even pro. We see all of those types of people. And it's sometimes thought of as work comp for the child when it comes to these young elite athletes and how important it is for them. And really to put in perspective their injuries and what's important to them at that point in their life. There's a lot of barriers and challenges that go along with that. Really what we think about in the onset of communicating with young athletes is a lot of times all patients or parents know is, what have they seen on TV? What's the usual treatment for an injury for a pro athlete, quarterback in the NFL who had this injury? And what is my treatment? Is it going to be the same? Should it be the same? Sometimes the answer is yes, other times maybe not. What's medically necessary versus what's standard of practice? What risk can we assume? Sometimes we do have to say, well, there's going to be a risk if you choose to participate. My job is to guide and say, we think that that risk is reasonable versus this risk is not a good option because it may affect you in the long term. So that's really important as well. And I think being upfront and honest is really important in communication for young athletes and patients in general. Just switching gears, the hand, we'll talk about the hand and wrist. That's why we're here. It's such a unique, beautifully designed system. And that's why I like it too. That's what makes my job so rewarding. I see things every day that sometimes I've never seen before. And it has to do with the anatomy of the hand. It has to do with unique patients, and that's really enjoyable for me. This is a skeleton and an x-ray of the hand. You can see that there's different segments of fingers. There's metacarpal bones. There's all these small bones in the wrist that we need to pay attention to, along with the joints that go along with them. We have flexor tendons that are so very important that help us to bend our fingers and move. And the design is so intricate. It's really important for us to understand the anatomy as physicians and as a healthcare team, because examination of a patient is really important. When we're examining a patient, it can really tell us a lot about the injury. The extensor tendons help us to straighten out. They have all these support systems along the back of the hand. And going along with that, the exam discussion about the type of injury and how it happened is very important for us as physicians to know. But sometimes we need some additional testing. X-rays can be important. They often are very important. MRIs can be important, ultrasound. These other types of imaging can help to supplement what we know and what we want to know about an injury. And this is a good example. This is our first case example. This is a 15-year-old high school student. She's a softball pitcher at a high level, and she was pitching in a game and had a ball hit right back to her, and it struck her finger. She had swelling in her finger, pain near the joint, in the middle joint, we call the PIP joint, and a lot of bruising. And how do you know? How do you know if this is simply a bruise, whether this is a finger sprain? We see these every day. If you sprain your finger, you bend it the wrong way, whether it's dislocated or whether it's broken. Well, sometimes we can recognize that right away, but other times we need to get imaging. We need to get more testing. And this is a very good example. This is an x-ray you see here of this joint, this PIP joint, where there is a fracture and a dislocation of that finger. This is not simply a sprain. This is quite a serious injury and quite a complex one to take care of in any patient, especially in a young athlete. Finger dislocations, they're pretty common injuries. That's when all the ligaments fail, or many of them fail in a particular joint, and it results in instability of a joint. Any joint in the finger or the hand can be involved. And what we think about as hand surgeons is how it was dislocated, whether it went up, whether it went down, whether it is kind of twisted and rotated. Those are really important things to think about in how we will treat them and how they can be put back into place. Again, they're pretty common, and a lot of times with a finger dislocation without a break, we can simply put them in a buddy splint, which is taping two fingers together. We really want to start motion early if we think it is safe, and that's our job to guide an athlete to know when it's safe to move. And sometimes we have to operate on them if they can't get back in place in time, but a lot of times we don't have to. Again, revisiting the case where we're at, this is not simply a dislocation, this is a break as well. And so this patient, we had to discuss surgery. This is a fracture and a dislocation together. And you only would know that really by looking at an x-ray and talking to the patient. So we had a discussion with the patient and the family about what would be best. And it was decided that we would fix this break because otherwise it was going to lead to instability, meaning the joint wouldn't be very stable. It could lead to arthritis at a really early age and stiffness. So we wanted to do the best job we could to try to avoid that. So we fixed it. We fixed it with a little tiny plate and screws, and we can do that sometimes with this particular break to keep it stable. That allows us to have a balance. Again, a very important concept in hand surgery and finger injuries specifically is we want to get moving early. We want to get moving early but safely, because stiffness of the finger is one of the most challenging things that we deal with any type of finger injury. So we have her moving early. She did very well. She started moving safely with our hand therapy team. She was not able to play any softball for at least 3 months that we talked about. She did have some stiffness, so we decided that another surgery to remove that plate and screws, and you can see her x-ray after that, would be done. And we kind of did what we call tenolysis, which means we free up some of the scar tissue around the tendon. It went very well. She ended up kept moving and had a very good return, and a return to softball activities in about 6 months after it was all said and done. What things do we think about? Not only with an athlete, but any patient, we think about what is their hand dominance? Age is very important sometimes, because some athletes, young athletes in particular, are not at skeletally mature. They have open growth plates. That affects our treatment, that affects their healing, and it affects healing time as well. And also the level of competition. You could be a youth athlete, you can be high school, college professional, and there are varying degrees, as you all know, if you have children, or if you're a coach, or simply any family member, or maybe you're an athlete yourself. There are just different levels. And it really is important to know what we're competing at, what our goals are, and kind of putting that into perspective with how we want to treat. It's also important about what type of sport it is. Is there any equipment that we could maybe adapt to be safe? If you have a finger sprain, maybe we simply need to do a little bit of buddy taping. Maybe a splint would be helpful. Maybe there's a protective wrap that was required or would be helpful as well. The position of an athlete, not all football players would be treated the same for the same injury. A lineman versus a wide receiver that has a finger injury, we may be able to create like what we call a club cast for a lineman that really protects their hand, because he doesn't need to move his fingers as much as a wide receiver who needs to catch a ball. A goalie in soccer or hockey versus a hockey or a goalie or a player in soccer is different. They're treated differently with finger injuries, and that's really important. And whether you have to hold a stick, how much impact and contact the sport requires. That's all things we think about and discuss with patients. Here's our second example. This is a 41-year-old. He's a golfer, and he simply jammed his fingertip on a boat, and he noticed that he had a droopy finger. This is a pretty common injury that we see in athletes and non-athletes. This is called a mallet finger. This is an x-ray that shows a break. You can see at the tip joint there's a little crack in the bone, and that is what we call a bony mallet finger injury. It is as much of a tendon injury. Tendons, we talked about that. Those are the structures that help us to straighten our fingers out or bend them. It is as much of a tendon injury as it is a bony injury, because it helps us to straighten that tip of the finger out. And you can see here that we talk about that. There can be injuries that include the bone, injuries that don't include the bone. We see them both oftentimes, and fortunately, they are treated non-operatively. I would say about 90% of mallet finger injuries that we see are treated without surgery, because we know that they're stable. We know that they do well in a splint, and we know that we can get them moving, and outcomes are usually pretty similar to whether we have to pin them or not. There are some things we think about whether we have to put a pins in or do surgery, but often they can be treated without surgery. But the non-operative treatment can be quite extensive. It involves a splint that you may wear for 6 or 8 weeks, such as the one you see on the x-ray to the left. There's a splint that's metal that's going right over that joint, and that's how we treated this patient. The joint stays stable, and over time that bone can heal, and so can the tendon. But sometimes, as you see to the right, this is a different case. We have to pin it, and we have to put pins in to kind of keep things stable. And again, that's a discussion we would have with an athlete. Sometimes we have it with non-athletes, in an example such as a person who can't protect their pins and needs to wash their hands frequently. Well, sometimes we'll bury those pins and we'll treat it with surgery because of that. We have to consider each injury on a spectrum, and really timing is very important sometimes with athletes. How does the treatment impact the athlete on the timeline? I like to break it down as some other presentations I've seen is when I talk with an athlete is how is it affecting us now? How is it affecting you now in the current season, the next few weeks? And can we safely treat it that way to allow you to participate? Maybe not. How will it affect you in the next few months or the rest of your high school or college career? And then long term, where are you going to be in 5 years and 10 years? I think that's really important to share all those perspectives, because as we know, we live in the moment. Athletes, especially young people, live in the moment, and it's hard to consider the big picture. And I think it's important to sort of break it down in that way so that we understand parents, athletes, and the team of treatment, where we're at and what's going to be best for them. This is an example, a good example that kind of highlights that. This is an 18-year-old. He's a senior running back. He just completed his senior year. He's a high-level running back. And he had his thumb pulled away when it was caught in a face mask. But this happened in August, and he saw me at the end of the football season and towards the end of the year because he wanted to play football throughout the year. He may have mentioned that his thumb was a little bit sore to the athletic trainer, but he wanted to play, and he wrapped it and he played. But at the end of the year, he said, as he was lifting weights and doing other things, you know what? My thumb doesn't feel very stable and it still hurts. So we got some x-rays and we ended up getting an MRI that showed he has another common injury, which is an ulnar collateral ligament injury of the thumb. A thumb sprain, yes, it is, but it's more than that because it's pulled away completely. The ligament is torn off, and sometimes that can lead to an unstable thumb that simply doesn't heal on its own. It can be referred to as a skier's thumb because when a skier holds the pole and falls, sometimes that thumb bends awkwardly to the side. Gamekeeper's thumb is also referred to in more chronic cases. But it is a common injury we see in athletes, and it's that middle joint right where our thumb web space is, and it pulls off to the side, and you can see a few images there. There's the ulnar collateral ligament. There's a specific lesion called a Stenner lesion, where that ligament, no matter how long we take for it to heal on its own, although we sometimes can treat these injuries, this one will not heal because it just simply can't lay down where we want it to heal. Ulnar collateral ligament is more common than the other side, the radial collateral ligament. But a lot of times, these injuries are seen in a delayed fashion. And that's why I bring this case up. Because sometimes an athlete doesn't know. They think they may have just sprained it. It's been swollen, but it keeps hurting. And so we can see them in the chronic phase. Sometimes we see them early. They can be stable. They can be unstable. We have to determine that with our exam. We can determine it with additional imaging. And just with them telling us, it just doesn't feel right. It feels like it's weak. It feels like it kind of moves a bit too much. And so that's all the things we think about. When we repair these, it also depends on the timing. Sometimes we'll be able to put the ligament back down and fix it with some strong anchors and stitches. Sometimes we have to supplement it with some grafting and other ways to reinforce this tear. And in this athlete, we ended up fixing him. He rehabbed, and in his case, it was the off season. So that's another thing we'll talk about. When in season is this injury? Well, his was the off season. He kind of made it that way, but it allowed him to rehab and heal and play football in college then the next year. Again, what are we thinking about? Again, going back to what hand and wrist injuries are in relationship to the individual. We think about the athlete, the injury itself, sports, and the timing in the season. We think about injury factors like, is this a partial versus a complete ligament injury? It could be an injury in the wrist that's the scapholunate or the TFCC. These are abbreviations and terms for these ligaments that are very important in the wrist. And sometimes they're just small tears. Other times they're bigger tears that need to be fixed. If it's a fracture or a break in the bone, is it displaced? Is it shifted? Or is it really lined up well? And we say, you know what, this will heal on its own. We can cast this. Or is this an acute injury versus a chronic or overuse injury? Now, I haven't touched on chronic and overuse injuries, and I'm sure many of you have had those potentially. But it is very important to consider, is this something you just did? Is this something that you're doing because you're overusing it? And that may be for another talk, but it is certainly encompassed when we think about athletes and injuries in general. This is an example. Now moving on to the wrist. We have a collegiate athlete. He's a safety in football, and he was making a tackle and noticed that he had right wrist pain. At first glance, we wouldn't see that there is anything wrong with this patient, but a trained eye can see that there's a small bone. It's the kidney bean shaped bone there that is the scaphoid. And this is an injury that is unique. It is rather common as far as wrist fractures go. And, you know, this is a tough injury to treat because this is what we call more of a proximal pull of the scaphoid fracture. This is a bone that is unique. and healing. And this is an example not of this patient, but of another patient where the patient thought, well, maybe I sprained my wrist. It's been painful and swollen, but it starts to not heal. This is a scaphoid fracture with like a non-union. You can see that dark spot in the middle. This is a cyst that's forming there because that bone is not healing. Well, why isn't it healing? Because these particular injuries have a blood supply, the scaphoid, that's unique to the bone. And sometimes that blood supply doesn't get the way that it needs to for a bone to heal. Maybe the athlete's moving it or the patient's moving it too much and they don't recognize they have the break. So these can be really hard surgery or hard injuries to treat. And a lot of times we do have to do surgery in order for them to heal properly. Switching gears, what about a 53-year-old pickleball player who has a wrist injury? She jammed her wrist into a wall and fell a pop and had pain. Well, this is a different injury. This is not the scaphoid, but this is the radius, another common injury and a wrist fracture that we see where the wrist is bent back. You can see that there's that little cup of the wrist has a break there, and that is the radius bone alongside the ulna. She also broke her ulna bone, a common pattern in injury. Two injuries treated differently, two different types of athletes treated differently with a different discussion. Both of these injuries, unfortunately for the patient, but with good outcomes, ended up with surgery, but they did very well. Moving back to the scaphoid, we talked about this athlete and these athletes, they have a scaphoid fracture. It's one of the frequently fractured, what we call carpal bones, these small bones in the wrist, up to almost 15% of acute wrist injuries. And a lot of times it is related to contact sports. I see a lot of athletes, they're football players in contact sports with this injury. The location of where that break is, whether it's close to the radius, whether it's closer to the fingers, determines how it heals and how we treat it. And a lot of times we will use an MRI or a CAT scan to help us to understand these fractures. Distal radius fractures, on the other hand, in the other patient we saw, these are very common injuries. We see these in athletes and elderly patients, pediatric patients. Almost 1/6 of the fractures treated in the emergency department can be wrist fractures, we think. And there's a wide spectrum of ages. They can be associated with ligament injuries, other bones being fractured, and a lot of times it is a fall onto an outstretched hand or wrist, this type of injury. A lot of times we'll see bruising, deformity of the wrist. We think about how we treat wrist injuries based on the fracture pattern, how much the fracture is displaced or shifted, whether this is a stable or unstable pattern. Those are all things I'll talk about with the family and athlete and any other patient as well. Sometimes we can treat it with a cast. Sometimes we have to treat it with the plate and screws and fix it. And a lot of times for distal radius fracture, it takes about 2 months to heal, but early motion and if surgical intervention is chosen, can be done. We can start moving a little bit earlier than that. Going back now, we're skipping back and forth. Our athlete with a scaphoid fracture, what do we do for him? Well, we put a screw in the scaphoid, and that's what you see there. That keeps it stable. It allows it to heal a little bit more reliably. Sometimes we even put some bone graft in it. These injuries take longer than radius fractures to heal typically. And at about 10.5 weeks or 10 weeks after surgery, we even got a CAT scan. You can see on the right, that's a CAT scan that shows that bone is healed. It's well aligned. And that's what allows us to guide a patient or an athlete specifically to return to their sport. That's very important. And that's why we'll often get a CAT scan in these cases. There you can see some other CAT scans and x-rays as well. These are some other ways we treat scaphoid fractures, sometimes with smaller screws, pins, even a plate and screws we can use in these cases. These are some other cases I've done. What do we do with a patient that fell while playing pickleball? Well, we fixed her as well. We did surgery. We don't always have to do that, but we did fix her. We put a plate and screws and even some pins in that ulna. And she is recovering and doing well as well, getting moving. So again, two different athletes, two different timelines, and different discussions that we have in cases of wrist fractures and breaks. So in conclusion, what we've talked about a little bit today, hand and wrist injuries in the athlete, they come from a variety of locations based on anatomy, sports. I see all different kinds of sports. I see motocross sports. I see, the more traditional contact sports. We see overuse injuries from tennis and golf, all different ages. Pickleball is such a common athlete, and these are some of my most determined patients for sure to get back to playing pickleball. It's such an important part, and when we get that, and we want them to be able to do that. treatment, it's not only based on images and the exam, but also we have a discussion. Communication is key. Remember, we have to talk about what type of athlete, what position, what time of the season is it, and other factors that may be unique to the person. And finally, the physician's role. What is my role? Well, my role simply is usually to provide guidance for a patient or a family to make an informed decision to get the best outcome in the immediate term, intermediate term, and long term. And that's the way I like to think about that often, and just to try to get patients better in that way. So that's all for the presentation right now. I know that's kind of a buzz through hand and wrist injuries, but basically, that hopefully gives you a bit of a flavor for what I do and how we talk to patients on a day-to-day basis. And now we'll maybe go to some question and answers here. Okay, the first question says that a patient's a person here is saying that I have a history of some broken fingers when they played sports when they're growing up. And now what can they do to prevent arthritis? It's a good question. And it is one of those types of injuries where breaks in the finger really depend on where the break is. That first patient we showed on that on the case, that break was in the joint. And those are the types of breaks which really can lead to arthritis. And so if your break was in the joint, there's a possibility that there may already be arthritis, maybe not. How can you prevent arthritis in general? Movement helps. Being active, it doesn't mean you have to be gripping a ball and doing these really strong exercises, but we do have some what we call arthritis principles that we talk about in the clinic, how we can prevent it, doing some stretches, some protective mechanisms for gripping and pinching, maybe using aids that can help you to open jars, things like that people can do in general. But specifically, if you've had a break in the finger, it doesn't always mean you're going to get arthritis. It really has to do with where it is and where it is along the joint. Are there certain stretches that I should do, the next question, on a regular basis to prevent injury? A broad question, but a very good one, and something we really didn't touch on. Pre and post stretching and whether in any type of activity, whether you're just doing regular exercise or whether you're doing a sport. And I think it is important. I think probably most importantly that what I see as a hand surgeon are these wrist and forearm stretches, because one of the most common things that I will see are things like tennis elbow and golfer's elbow and wrist tendonitis. And we do have some stretches we can guide you to on the internet and even YouTube and our therapists that could show you some stretches to prevent injury. But those are usually the most common things that we see, at least in my day-to-day, when I'm talking about stretches. This is a question that asks about, basically that this patient had this person had a cut that sounds like they might have had some stitches in their skin. And can you play a sport with stitches in? I think that's usually an individual discussion with the doctor, but for me, I usually say no. I usually say that there is a healing process with the cut. There's swelling, there is internal healing and external healing, and usually we don't try to do too much sweating contact sports with stitches in, because it can lead to problems like the wound not healing right, can lead to things like infection. I kind of have the same rule when I put pins in as well. I don't like to have athletes play with pins in generally, because those are things that can lead to some further complications. There's a question about stiffness. Hands are stiff in the morning. Is it a sign of arthritis or could it be something else? It's a good question. Yes, and yes, it could be a sign of arthritis because stiffness is associated with arthritis. But you're right. It could be something else. There are other structures in the hand that we kind of alluded to earlier. These tendons that help us to move, they can get stiff and inflamed. Some people get common things like trigger fingers, where they're most painful in the morning. Even things like carpal tunnel syndrome, where people feel like their hands are stiff and swollen in the morning, can be that. So it could be nerve, it could be joint, it could be tendon. Now, I know that's not answering your question, but I think that it doesn't mean you have arthritis if you get stiffness in your hands in the morning. The next question is, how long does it take a broken finger to take, or how long does a broken finger take to fully heal? Well, that is a pretty broad answer, I would say, and that is because It depends on, again, where the break is. Is it near the joint? Is it in the shaft or in the middle of the joint? Is it not shifted at all? Did we, is it really shifted and it's really unstable? Is it in a bunch of different pieces? Is it a child that may have open growth plates? And so those are factors we think about. In general, though, how long does a broken finger take to fully heal? In a child, sometimes as early as 3 or 4 weeks. In an adult with a bad fracture that may involve the joint and we have to kind of keep it stiff longer than we want, maybe even up to 10 to 12 weeks. They can take that long sometimes, but usually it's somewhere in between. For the thumb sprain that you mentioned, can it damage it more by not addressing it earlier? It's more about discomfort management. That's a really good question. And that's a question that I see a lot of times. So they're asking, with the thumb sprain, the ulnar collateral ligament, that skier's thumb that we talked about in the running back, is it possible to damage your thumb more? Yes, it usually takes a longer period of time to not have a stable thumb. But sometimes if it's not moving correctly for a long period of time, you can even get arthritis because it's not moving properly in the joint, and that ligament can be important. But sometimes it is about discomfort management, meaning, if you think that it's been a month or two and you say, boy, it still kind of hurts. I wear a brace. I try to protect it and it's getting better, but I'm just not sure if it's all the way. Maybe it just will take another month and that's all it will take. And that may be a good reason to come and see one of us. So a hand surgeon such as myself to say, all right, maybe we should get an x-ray at this point. Maybe we do need to get an MRI, or maybe we just need to reinforce you not using it as much. And maybe you do need to baby it and maybe use some tape or put a brace on a little bit longer. So, but that's a really good question, a common one that I get. The next question is, which sports are most common to overuse hand or wrist injuries? Well, I'd say overuse injuries can most commonly occur with repetitive movements. So, I mean, the classic is tennis and golf, right? These are injuries where you're constantly using a racket or a club to swing, and you're always trying to dial it in, your technique, and practicing, and that repetitive movement can often lead to overuse, these tendinitis types of things. Sometimes it leads to wear and tear of even some of the joints as well. But usually that's probably the most common that I see as far as overuse, repetitive activities. So commonly those racket sports. Okay, well, that was a really good questions from everybody, and I appreciate your participation. Again, I thank you for tuning in to listen to this webinar hosted by OrthoCincy and the Christ Hospital. Thank you. If you have any other questions, there's some information that you have there that you can reach us by phone number, by email, and my particular locations of my office are at Westchester and at Kenwood. And we have other offices throughout Cincinnati, as well as the Northern Kentucky and Indiana areas as well. So thanks again. Feel free to contact us if you have any other questions.